Hey everybody, if you're here because you're getting your very first CPAP machine, you've come to the right place. Today we're going to go over everything you need to know about using and taking care of your CPAP machine to treat your sleep apnea. So we're going to start off with the side effects of sleep apnea. Most people think of snoring, having trouble like tossing and turning and staying asleep, and feeling tired during the day. But there's a lot of other body symptoms that can be affected by your untreated sleep apnea. So we're going to go over all those symptoms, and you can hope to see improvement on those things once you get the hang of your CPAP machine. Then we're going to talk about how a CPAP works to actually open your throat and go over the way you put it together, take it apart, and maintain your device. And then we'll talk about your mask. We'll take it apart, we'll put it together, we'll get it on you, get it fitted to your face, and then we'll put them together and give it a try. Okay, we're going to pause right here, and I want you to mark off on the checklist all of the symptoms that you had. Okay, everybody ready? So now at the bottom of your checklist is a number. That number is your AHI, or your number of events. So let's talk a little bit more about how we came up with that number and how it's affecting you. During your sleep study, we monitored your breathing to check for breaths that were taking longer than they are supposed to. A normal breath is in and out in about 3 seconds. But this breath would take longer than 10 seconds to be completed. So you're either snoring or your throat is trying to close. At the same time, your oxygen would drop down because of it by at least 4%. So if that happens, then we mark that against you as an event. We add up all the events that you had during the sleep study, and we divide that by how long you slept to get our average, or AHI. So when we look at how well your PAP is working, we're going to be checking to see if those events have dropped back down into a normal range. Your CPAP machine is basically like a fancy fan. You can see here that it blows air down your nose and throat, and when you inhale, it's easy because we're going the same direction. I'm pushing and you're pulling. But when you blow out against me pushing in, that creates all this pressure that builds up and lifts the back of your tongue and your uvula and anything dangling into the way up out of your way so that you can breathe normally. If you have any issues with the air pressure, like if you feel bloated in the morning or smothered at night, or if anybody hears you snoring still, those are signs your pressure's not quite right and we need to call your sleep doctor. Now, I'm in charge of your mask and your machine. So if your dog eats your tubing, you're calling me. If you just need more supplies for your CPAP machine, you're calling me. If it's making a weird noise or you just need advice, you're going to want to give us a call. So there's a 2-year warranty on your new baby. You cannot smoke anything around it. If you drop it, especially with the water in it, the water will flood the machine and kill it. So be careful about that. No So-Clean machines and no bugs. So be careful where you take your PAP device. Every 5 years, you can get a new machine. So you'll just be getting a new order from your sleep doctor and coming back to see us. You can fly with your equipment for free. You just slide it over your little rolly bag. You take it on the plane, and they're going to store it in an overhead compartment as medical equipment. So it will not count against your carry-ons. And anything you need, we just mail straight to your house. We're going to call you 4 times a year to see if you need those supplies, and we're going to mail you a goodie box. So now we're going to go over all those pieces that you might be replacing, and the air filter is probably the most important Because the machine is a fan, it needs fresh air all the time. So we want to throw our filter away or wash it depending on what kind of machine you have. Distilled water is always best in our humidifier because there's no mineral to have to scrub out and no germs that are going to make you sick. And when you go to wash your stuff, use warm soapy water like baby shampoo, ivory, or dish soap. So all these pieces that you need to take care of are listed on the back of your paper. So let's turn it over and let's go over your device piece by piece.
Using your Airsense 11. Let's get you familiar with your ResMed Airsense 11. Start by connecting the power supply.
Okay, so it's in the back of the machine. You're going to want to turn it around, and it only fits in one way. Perfect.
Connect the air tubing firmly to the air outlet located on the rear of the device at the top.
Okay, so that's in your little bag there. And that in with the little plug, he's going to go back here on the back of the machine. Perfect.
Hold the humidifier top at the top and bottom. Press it gently and pull it away from the device. Open the humidifier tub. To use humidification, you will need to ensure your humidifier tub is filled with water and insert it in the side of the device. Your Airsense 11 has a touchscreen and a start and stop button. From the home screen, you can select My Options, which lets you view and personalize your comfort settings. You can scroll down to view more options. If you need to make a change, tap OK on the touchscreen to confirm. You can then tap the Home button to navigate back to the home screen. My Sleep View automatically generates a summary of your last therapy session when you wake up and press the Stop button. Finally, the More menu contains other settings such as My Air app connectivity and airplane mode. When you're ready to sleep, just press the Start button. In comfort, ramp. Your ResMed Airsense 11 offers features that were designed to maximize your comfort. The ramp setting allows you to fall asleep comfortably by starting at a low pressure and gently ramping up to your prescribed pressure. The setting for ramp time is located in the My Options menu. When set to auto, your device will ramp up to your prescribed pressure only when it detects that you've fallen asleep, giving you the right air when you need it. Alternatively, if you want to take control, you can set a specific ramp time. Or if you experience the feeling of not getting enough air, you can turn the ramp time to off.
Okay, so because your doctor set your pressure so low to start with, you're on that big range where it adjusts itself up and down, you're already low. So there's really nowhere for me to ramp you to. So I already turned your ramp off for you. But if doc ever decides to turn your pressure up, we'll have a conversation about whether or not you want me to turn that ramp on so it'll step you up into that air pressure, okay?
Maximizing comfort, humidification. Your ResMed Airsense 11 offers features that were designed to maximize your comfort throughout the night, which can help you adjust to treatment. Heated humidification has been shown to relieve some of the side effects of therapy, such as dry nose or mouth. To use humidification, you will need to ensure your humidifier tub is filled with water. Your humidification settings are located in the My Options menu. If you have a Climate Line Air11, you can set your climate control to either auto or manual. Auto climate control will ensure temperature and humidity are preset at levels designed to deliver comfort. Manual climate control will allow you to set a specific humidity level and tube temperature depending on your needs. If you experience droplets of water collecting in your air tube, also known as rainout, consider turning your humidity level down. You can also adjust your tube temperature to find your optimal breathing comfort.
Okay, so I went ahead and set your device to automatic, so you're not going to have to change anything, and it's going to test your house and adjust to how hot, cold, wet, or dry it is in your space. So if you suddenly go off to Florida on vacation, it will adjust to Florida for you. So if you just decide that you don't want to put water in it, we can turn your humidifier off, and that's what you would want to do so that you don't get dry air going down your nose and throat. So you would just let me know if you need any help turning that off, but it's also on the app that came with your machine.
Cleaning and caring for your Airsense 11. Gently pull it away from the device. Pull the humidifier tub at the top and bottom. Press it gently and pull it away from the device. Open the humidifier tub and discard any remaining water. Pinch the cup of the air tubing and wash the humidifier tub, air tubing. Rinse each component thoroughly in water. Wipe the exterior of the device with a dry cloth.
So I just want to point out real quick to you that when they washed that tube, they got that pin wet that you plugged in when you plugged it in the back of the machine. So it's totally washable and submersible, that little plug guy. It's totally fine.
Checking. Regularly check the humidifier tub, air tubing, and air filters for any damage. Check the humidifier tub. Replace it if it is leaking or has become cracked, cloudy, or pitted. Replace it if the seal is cracked or torn. Remove any white powder deposits using a solution of 1 part household vinegar to 9 parts water. Rinse with clean water. Check the air tubing and replace it if there's any holes, tears, or cracks. Replacing the air filter. Open the air filter cover and remove the old air filter. Place a new air filter onto the air filter cover and then close the cover. Make sure the air filter and air filter cover is fitted at all times to prevent water and dust from entering the device. The air filter is not washable or reusable.
Okay, let's go ahead and spin your machine around real quick and take a look at that filter. See a little door back there? Go ahead and drop him open, and you can kind of scoop it out of the lids like a little piece of paper. There you go. So he just gets thrown away twice a month, just like a little schedule, and this is your next one so that you can change it in 2 weeks when that one starts to get dusty. Okay, so now that we've got your machine assembled and kind of ready to rock, we're gonna go over all the different parts to your mask. So at the bottom of the sheet I gave you, it has all the different pieces for the mask. You see most of the stuff is cleaned weekly, but that part that actually goes in your nose, you're gonna clean him every day. And then this is how often you replace your pieces. So let's get it out and put it together. Okay, now that you got your mask on, it's time to give it a try. And I'm gonna give you some tips for getting the hang of all this. So keep in mind that you're starting a new habit today, and new habits take time. Even your insurance is giving you 90 days to try to work out the kinks and get the hang of it. And sometimes it can be a bit of a process. Sometimes the doctor and I need to make changes to smooth things out. So try to be patient with it. Feel free to put it on and just watch TV or do something with your hands. You basically want to just distract yourself so you're not thinking about every little breath that you take, and you can ease into it a little bit. Try not to skip any days. If you skip a day, you'll skip a week before you know it. And the only excuse insurance accepts is being in the hospital. Every little minute that you wear your machine counts. So when you put it on and you practice, you'll get credit for that too. And as soon as you hit 4 hours, they'll pass you for the night. Keep in mind that your day starts at noon and goes all the way around to noon again. So you've got 24 hours to get your 4 hours in. But your doctor is expecting you to wear it all night and every single nap that you take. So you're going to want to follow back up with him within 90 days so you can show off your good behavior.